Hi, my name is Roselia Contreras and my topic is cytomegalovirus prophylaxis in hematopoietic cell transplant. Introduction. Hematopoietic cell transplant recipients, especially those who have received allogeneic transplants, are at increased risk for a variety of infections depending on their degree of immunosuppression and exposure. The term hematopoietic cell transplantation will be used throughout this topic as a general term to cover transplantation of hematopoietic cells from any source. Definition. Cytomegalovirus infection and disease are common problems in patients with TOS and TPH. The severity of the complications associated with this virus depends fundamentally on the type of transplant and the previous immunological experience against the donor virus and the recipient.
Cytomegalovirus is an enveloped double-stranded linear DNA virus in the herpes virus family. It is also called human herpes virus 5. This virus can cause a variety of infections in humans, including congenital infections in infants. It is one of the TOTS infections and can cause hearing loss, seizures, and petechial rash in newborns. In adults, infection can cause mononucleosis, although 85% of mononucleosis causes are associated with Epstein-Barr virus. Symptoms of mononucleosis include fatigue that can last for several months, sore throat, lymphadenopathy, and splenomegaly. Unlike mononucleosis caused by Epstein-Barr virus, cytomegalovirus associated mononucleosis has a negative monospot test due to negative heterophil antibodies. CMV can also cause pneumonia and inflammation of the retina and esophagus in the immunosuppressed, especially in transplant recipients. Once a person becomes infected with CMV, the virus stays latent in mononuclear cells throughout his or her lifetime. Visualization of owl's eye inclusions in a cell is highly specific for cytomegalovirus infection and can aid in disease diagnosis.
Applications in medicine. Appropriate diagnostic tests are essential for the management of cytomegalovirus infection and disease in immunocompromised patients. Several diagnostic modalities are available, including serology, quantitative PCR, PP65, and histopathology and diagnosis of recent or acute cytomegalovirus is considered probable in the following circumstances: the detection of cytomegalovirus-specific immunoglobulin M antibodies, and fourfold or greater increase in cytomegalo-specific G titers in paired specimens obtained at the least 2 to 4 weeks apart. Continue with the video. Pros and cons. Pros: Valganciclovir hydrochloride, a prodrug of ganciclovir, is used successfully to fight cytomegalovirus. Its viability is 10 times greater than that of oral ganciclovir. Cons: Cytomegalovirus can infect almost all parts of the body such as cytomegalovirus, rhinitis, colitis, and encephalitis. Issues apply in Ecuador. In Ecuador, there are no publication studies in this regard, but in the United States is considered the most common congenital viral infection affecting approximately 40,000 children per year. When a primary infection occurs during pregnancy, there is an increased risk of infection in the fetus and newborn. It can be cause of premature birth and low birth weight infants for their gestational age. Continue with bleeding. Conclusion: Cytomegalovirus is a member of subfamily of herpesviruses. Cytomegalovirus infection occurs vertically and horizontally, and the virus is transmitted by direct contact of infected body fluids with breaks in the skin or mucous membranes. The most frequent treatment is with antiviral drugs. These medications can slow down the speed of virus reproduction, but they do not eliminate. Continue with P.
Why moms-to-be should care about CMV. Okay, what is CMV? It's cytomegalovirus, and it's a common virus that a lot of people are infected with. The good news? It doesn't affect most people. For them, there are no symptoms. In fact, some people even call CMV the silent virus because it's so harmless to many. The bad news? It can be pretty serious for certain groups of people. The group that we're concerned about here are unborn babies. They can catch it from their moms. That's called congenital CMV. And it does affect the babies. There can be bad symptoms. Here are the statistics. About 1 in every 150 babies is born with CMV. Of those, 80 in 100 are fine. No symptoms at birth, no symptoms ever. It's the 20 out of 100 that we're concerned with here. The effects of CMV on those babies can be pretty scary. At birth, these can be premature birth, liver, lung, or spleen problems, small size at birth and small head size, seizures. For some, the symptoms develop after birth, including hearing and or vision loss, mental disability, small head size, lack of coordination, seizures, and in really rare cases, even death. Now remember, these are babies that catch the virus before they are born, inside of mom. Kids who catch it after they are born are fine. Remember we said it was a common virus that people may not even know they have? That might make you worried that you already have the virus and that you will pass it to your baby. Okay, listen carefully. If you had the virus for months or years, there is virtually no chance that your baby will be infected. It's only when a woman becomes infected right before conception or when the baby is in the womb that the infection passes to the baby. So what we want to do here is to reduce the chance that you will transmit the virus to your baby by reducing your chances of being infected with the virus at the wrong time. More good news here. What you have to do is really simple, ridiculously simple. You see, the virus is transmitted via bodily fluids like urine and saliva. Ironically, the person you're most likely to catch it from is a baby, maybe your own, or maybe you come in contact with other people's kids. So if you are pregnant or planning to become pregnant, follow these simple steps. Wash your hands often with soap and water for 15 to 20 seconds, especially after changing diapers, feeding a young child, wiping a young child's nose or drool, handling children's toys. Do not share food, drinks, or eating utensils used by young children. Do not put a child's pacifier in your mouth. Do not share a toothbrush with a young child. Avoid contact with saliva when kissing a child. Kiss them on the top of the head, not the mouth or face. Clean toys, countertops, and other surfaces that come into contact with children's urine or saliva. So there it is, CMV,